With Joe Biden's diagnosis of prostate cancer, there are many that are rightfully asking questions about prostate cancer, but as a physician, I know very well that very few people know exactly where the prostate even is and what exactly it does. So let's just talk about that for a moment. The prostate is a gland that can be found in patients assigned male at birth, and the anatomy is really important to understand because that's going to then help us to understand the symptoms associated when things go wrong. So the gland is located just below the bladder, and the main function of this gland is to create fluid that carries sperm or seminal fluid. Now, an important note about anatomy, the urethra, or the tube that drains the bladder that helps us to urinate, runs through this gland. Now, a very common problem that I actually see in the emergency room is when that gland enlarges. Unfortunately, just sometimes as a consequence of life, that gland can enlarge and then compress on the urethra, which doesn't allow the bladder to empty fully. Now, you can imagine when that happens, that can create symptoms that the patient then presents with to the hospital. And that can include difficulty with urination, sometimes feeling like you have to strain. Sometimes it can create the feeling of urgency, or you have to constantly run to the bathroom. And even in certain cases, it can lead to pain and bleeding. Enlargement of the prostate gland is most often not cancer. Another reason that the gland can become enlarged or inflamed is due to an infection. And an additional reason, which is why we're talking about this today, is prostate cancer, which is one of the most common cancers in patients who are assigned male at birth. In Joe Biden's case, he was found to have a prostate nodule that likely then led to additional testing to understand whether or not that nodule was a problem. After that nodule was found, he likely had additional screening, for example, imaging. That could have been an ultrasound or an MRI to understand what this nodule looks like. And then eventually he had a biopsy. A biopsy is done when we remove a certain amount of tissue from the body to examine it under the microscope. That's when a pathologist, that's a provider, a doctor who specializes in looking at tissues under a microscope, helps us to understand if that tissue is cancerous. And unfortunately, in the case of Joe Biden, it was found that that tissue was cancerous and he was diagnosed with prostate cancer. The process of a biopsy also comes with scoring to help us to understand how abnormal these cells are. And that is what a Gleason score is. The higher the Gleason score, the more abnormal the cells are, the more likely those cells are to spread. Gleason score of 8 to 10 indicates a more severe, more aggressive form of cancer that is more likely to spread to other parts of the body. Joe Biden received a Gleason score of 9. Additionally, certain types of prostate cancer cells respond to hormones. Hormones like testosterone can drive the growth and survival of normal prostate cells as well as cancerous prostate cells. And in the case of Joe Biden, it was found that his type of cancer was hormone responsive, which means that there is an additional option for treatment where medications that block those hormones can reduce the risk of recurrence and spread of the cancer. After that score is completed, the patient is then often screened to see if there are any signs of metastasis or spread of that cancer to other parts of the body. For prostate cancer, for reasons that we don't completely understand, it often spreads to bone, and in this case it was found that Joe Biden had a metastasis or a spread of that cancer to his bone. The picture of prostate cancer today looks very different than it did 30 years ago. There's an estimated 3 million people living with this diagnosis within the United States, and thanks to screening, early detection, advancements in treatment, and funded research, the rate of death or patients losing their life from this diagnosis has decreased by approximately 50% in the last 30 years. I'm so grateful when people share their stories, especially those with large platforms, because it helps to start conversations which inevitably can save lives. It's important to remember that the general guidelines recommend to start screening for prostate cancer at the age of 55, but I recommend having that conversation earlier in your 40s, especially if you carry a higher risk. For example, as a black man, as black men, we carry higher risk, up to 60% higher risk of a diagnosis and an increased risk of death. And important to remember also for those who have family history, those who have genetic risk factors, starting conversations early most often leads to a better outcome. Hopefully this helps you to understand what you need to know about prostate cancer and also helps you to start that conversation with someone you love. Okay, talk soon.